We are going to start non-beta lactam antibiotics. We have tetracyclines, chloramphenicol, macrolide, and aminoglycoside. In addition to the four ring of tetracycline cycle, at position number 2 we have an amide, and at carbon number 4 we have a dimethyl amino. These are shown by the red arrow. In the 6th position we have methyl. As you see here, it is below the plane, while the hydroxyl group at the carbon is above the plane. Here in the structure we have three hydroxylic groups. As you see here, one at the 3 position, the other at number 6, and the third one at 12A. And we have here 3 groups: the amide at position number 2, dimethyl amino at position number 4, and the methyl at position number 6. What are the uses of tetracyclines? Tetracyclines, they are broad spectrum, so they are active against gram-positive and gram-negative, but they are bacteriostatic, and as we said before, bacteriostatic inhibit the growth but do not kill the microorganism. They are specific to treat the acne by suppressing both the skin bacteria and their lipases, which promote the inflammatory changes, so they treat the acne. What is the mechanism of action of tetracycline? Tetracycline, they are specific inhibitors of bacterial protein biosynthesis. How they inhibit the bacterial protein biosynthesis? By binding to the 30S ribosomal subunit. This is the mechanism of action of a tetracycline. What are the side effects of tetracycline? We have here 6 points. They cause gastric discomfort. They can cause hepatotoxicity. They are phototoxicity. How they are phototoxicity? If the patient is exposed to severe sunburn, if exposed to the sun or UV rays, this will cause severe sunburn. In addition to it can cause super infection. It can overgrowth candida in the fungi or the resistant staphylococci in the intestine. Number 5, it causes deposition in bone and teeth during calcification in growing children. Why tetracycline cause this deposition? Because they cause chelation with calcium, so they cause discoloration and hypoplasia teeth. The 6th point here, if you take an outdated or expired tetracycline, it can cause renal damage. These are the 6 points side effect of tetracycline. Tetracycline is acidic or basic. It is neither acidic nor basic. It is amphoteric, so it can form salts with acid and base. Therefore, it has an acidic part and a basic part. Where are these parts? The green one, which is the amide, it is 3.3. So this is the acidic part, while a dimethyl amino shown by the red marking, it is 9.7 pH, so it is the basic part, while the blue one downside, they are neutral, 7.5 pKa. So tetracycline are amphoteric, they can cause salts with either acid or base, because they have an acidic part and a basic part. We can speak about the chemical stability of tetracycline. They can undergo degradation in acid or base. We will start by the action of acids. It can be strong acid and it can be weak acid. We will start by strong acids having pH less than 2. What are the actions of strong acids on tetracycline? They undergo dehydration at C6, then aromatization of ring C. As we see here, the OH at carbon number 6 will be removed, shown by the blue arrow, will be removed by the proton at 5A, shown by the red arrow. It will here release water. Then here the double bond shown in ring B, shown by the green arrow, will undergo here rearrangement, forming the right one, which is the aromatization of ring C. This compound is known as anhydrotetracycline. So strong acids convert the tetracycline to anhydrotetracycline by dehydration and aromatization. In case of weak acids having the pH from 2 to 6, here epimerization can take place, forming 4-epitetracycline. The left side is tetracycline. As we see here, a dimethyl amino is below the plane and the hydrogen is above the plane. By weak acid, they undergo epimerization and rearrangement, forming an epitetracycline. Its epimer, here the dimethyl amino will be above the plane and the hydrogen will be below the plane. Epimerization takes place. We do not like 4-epitetracycline, not recommended for 2 reasons. First, it is an inactive compound. Second, it can undergo dehydration in strong acid. Same happen removal of OH at C6 and aromatization of ring C, forming 4-epi anhydrotetracycline, which is nephrotoxic. So it is not recommended for 2 reasons. It is inactive and can form in strong acid 4-epi anhydrotetracycline, which is nephrotoxic. Here we show the action of acid, either weak acid or strong acid. What is the action of base on tetracycline? Here it will undergo lactonization, reaction between here the 6OH and the ketone group at C11. The reaction will take place here between the hydroxylic group at carbon 6 and the ketone group at position number 11, forming a lactone product. This structure is known as isotetracycline and it is an inactive compound. So in bases, lactonization takes place, forming isotetracycline, which is inactive compound. So conclusion, we can say that tetracyclines, if they are without the hydroxylic group at position number 6, it can resist the action of acids and bases, and also will have higher lipid solubility and so better absorption. So conclusion from acid and bases, if tetracycline has no 6OH, it can resist the actions of acid and bases and it will have better absorption since it will have a higher lipid solubility. There are certain precautions while taking tetracyclines. Tetracycline can form insoluble non-absorbable salt in the GIT with calcium, magnesium, aluminium and iron. Why they form this insoluble non-absorbable salt? Because it undergoes chelation with them. So we can solve this problem by taking the drug, whether it is milk, antacid, anti-anemic, 1 hour before the drug or 2 hours after tetracycline. So because it causes chelation with calcium, we cannot take with it milk. Magnesium we cannot take with tetracycline antacid. Aluminium and also aluminium. Also it makes chelation with iron, so we cannot take it with anti-anemic. So to solve this problem, take these drugs 1 hour before tetracycline or 2 hours after the tetracycline. Another precaution while taking tetracycline, they are painful upon intramuscular injection. Why? Because they will cause chelation with the calcium in the muscles. They will form in this case insoluble complex which will precipitate, so causing pain and irritation. How to solve this? We can take tetracycline intramuscular by adding EDTA to the injectable product. In this case, water soluble complex, EDTA will form a water soluble complex with calcium, therefore the tetracycline will not cause chelation with calcium and no precipitation and no painful upon intramuscular injection. The third one precaution while taking tetracycline, it is not recommended for pediatrics and children. Why? Because it undergoes chelation with calcium, forming insoluble complex which will precipitate in the teeth, causing dark colored teeth and deprive bones and teeth. So we solve this problem by not giving tetracycline to children between 6 to 12 years, to pregnant women and to lactating mothers. These are the 3 precautions to take care while taking tetracycline. What are the derivatives of tetracycline? Some of them are natural and others are semi-synthetic or synthetic. What are the natural tetracyclines? We have here tetracycline itself. As you see here, and we said before, 4 rings A, B, C, D, having 3 hydroxyl group and 3 groups, as we said before. This is most widely used because of its low cost, and it is considered to be the drug of choice in the treatment of acne. Another natural one is chlortetracycline. What is the difference between it and tetracycline is the presence of chloride atom at position number 7. This compound is no longer used. Why? Because of its poor bioavailability. But this compound is still marketed in ointment form for topical and ophthalmic use. For only topical and ophthalmic use. Another natural one is dimeclocycline. What is the difference between it and chlortetracycline? The difference is the removal of the methyl group at position number 6. So, in this case, the hydroxyl group at position number 6 is not a tertiary alcohol, but it is a secondary alcohol. So this compound is stable to acid and bases than tetracycline and chlortetracycline, because the hydroxylic group here at position number 6 is a secondary alcohol and not a tertiary alcohol. The fourth one, natural tetracycline, is oxytetracycline. What is the difference between it and tetracycline is the presence of hydroxyl group at position number 5. It is considered to be the most hydrophilic tetracycline. These are the 4 natural tetracyclines. What are the semi-synthetic tetracyclines? We have 2 from oxytetracycline, which are mesacycline. Mesacycline, as we see here, it is oxytetracycline but having no hydroxyl group at position number 6. So this compound is stable to acid and bases. It has a longer serum than oxytetracycline. Another one, semi-synthetic tetracycline from oxytetracycline, is doxycycline, which is known as vibramycin. Also has no OH hydroxylic group at position number 6, so it is stable to acid and bases. It has a long biological half-life. We prepare this vibramycin by catalytic hydrogenation of mesacycline. As we see here, the mesacycline having double bond CH2, so by catalytic hydrogenation we break here the double bond, forming methyl, which is doxycycline. Vibramycin or doxycycline, its metabolite excreted via bile into feces, so this compound can be given to uremic patients which with infections outside the urinary tract. Since it is excreted from the bile to the feces, so it can be given to the uremic patients having infections outside the urinary tract. Another synthetic tetracycline is minocycline. In minocycline here, the difference between it and tetracycline, we have no hydroxylic and methyl group at position number 6. but instead we have dimethyl amino at position number 7. It has here, so it is stable towards the acid and bases because have no hydroxyl group at position number 6. It has excellent blood level orally when taken orally because of its lipophilicity, and it has long action, so it is taken once daily. It is less painful on injection, but it has a side effect which is vestibular toxicity as vertigo and ataxia and nausea. So as we see here that this compound is very good. It is taken once daily, having a very good absorption orally because of its high lipophilicity, shows less painful on injection. So how can, it is not semi-synthetic, it is fully synthetic. How we can synthesize it? It is prepared from dimeclocycline. Dimeclocycline, by catalytic reduction, we remove here the hydroxyl group at position number 6 and the chloride atom at position number 7, so forming cycline. We undergo here nitration to cycline, so a nitro group will attach to ring D. Then we undergo reductive methylation using formaldehyde, so it will forming our compound which is aminocycline. The last one synthetic is Rowley tetracycline. Tetracycline here is not water soluble enough to give it intravenous to form a parenteral solution. So we solve this problem by forming Rowley tetracycline to give tetracycline intravenous. This compound is highly water soluble, used parenteral, also we can use it orally. We prepare it by using tetracycline, add to it pyrrolidine and formaldehyde in the presence of tertiary butyl alcohol, and this reaction is known as Manach reaction. Rowley tetracycline is prepared by tetracycline, pyrrolidine, formaldehyde in the presence of tertiary butyl alcohol. Here we finish the tetracycline, and we are going to speak about another non-beta lactam, which is chloramphenicol.